In this brief recording, I'll summarize a POM paper entitled Increasing the Supply of Health Products in Underserved Regions. This is joint work with Parag Kazaz and Prashant Yadav. My name is Scott Webster. So let me begin with motivation. So many health products remain inaccessible to individuals in low and middle income countries. Manufacturers underinvest in production and distribution capacity to serve these regions for a combination of two main reasons: higher risk for a variety of reasons that are listed there, and lower ability to pay. The consequence is that pricing to cover the risks and costs results in an unaffordable product for much of the population. So research context. So organizations such as the Gates Foundation and MedAccess, social investors, are interested in market-based incentives to increase the availability of health products in underserved regions. So in this paper, we look at the effectiveness of 4 instruments. These instruments are in the consideration set that social investors look at, that these organizations look at, to incentivize increased supply of health products. And in particular, the instruments you can see listed there. So subsidy per unit sales, this is a sales subsidy, so a subsidy paid from the social investor to the manufacturer per unit of sales. A capacity subsidy, which is a subsidy per unit of annual capacity. A low interest loan on some fraction of the investment in capacity. And then finally a volume guarantee, where the social investor commits to covering the shortfall of revenue in the event that volume is below the guaranteed number. So what do we find? What are the managerial implications? One is we develop a framework that social investors may use to evaluate the effectiveness of these different instruments, these 4 instruments. So what do I mean by framework? The framework or model yields a budget capacity curve for each instrument for a given spend on the part of the social investor, with the corresponding incentivized capacity. We also provide a strategy grid, builds on that foundation, that framework as a foundation. The strategy grid identifies types of conditions under which each instrument is likely to dominate. So what do I mean by dominate? Instrument that yields the highest capacity for a given spend on the part of the social investor. And so, for example, to make that concrete, and this is a simplified view of the strategy grid, there is more detail, of course, in the paper, but if ability to pay is very low, it points to the sales subsidy as the dominant instrument. Low ability to pay points to capacity subsidy. Moderate ability to pay, well, there are other factors that become influential in determining the dominant instrument. If the variable cost of capacity is relatively high and budget is low, for example, low interest loan tends to dominate. Budget is high, capacity subsidy likely to dominate. And if the fixed cost of capacity is relatively high with moderate ability to pay, it points to volume guarantee. I would like to acknowledge the Bill and Melinda Gates Foundation and MedAccess. These were 2 organizations that were involved in the research. They've seen early versions of the paper and started using the guiding principles. Thank you.